This is Jennifer from Life Extension.
Hello, thank you. While I have you here, I would just love to hear your thoughts and experiences with kind of the future of health and wellness and medicine, specifically looking at regenerative medicine like exosomes, PRP, stem cells, peptides, those kind of things. I guess where that's heading, accessibility, feasibility, and the efficacy of it.
Yeah, so I guess Dr. Sham's going to want to say something about this as well. But I think I really want to answer it at two levels. First of all, at what's available or about to be available in the clinic for human beings already, and second of all, what we're learning from that kind of technology in the lab in model organisms like mice. So the mouse side of things is what I do, of course. The fantastic news is that we are actually seeing genuine benefits at the level of life extension. Now, this is really important. Mice don't live very long. They live like 2.5 years, which means you can actually ask whether something makes mice live longer, which you can't really do with humans unless you do a really long trial, right? And the thing is, there's a huge, vast amount of skepticism and pessimism in society with regard to the idea that medicine will ever really be able to do anything about aging that's significant. And of course, we keep doing things about aging, but people keep shifting the definition of what they mean by aging so as to continue being pessimistic. So really, there's no replacement for lifespan data. And we're actually getting that. Not only that, we're getting it from treatments done with stem cells or exosomes and so on that are done late in life, like when the mice are already, let's say, 2/3 of the way through their life. That is critical because it means that we're showing bona fide rejuvenation as opposed to, something that doesn't really apply to people who are old enough to be paying taxes. So that's really important. But, of course, also it's really important that some of these things are already being shown to have health benefits in people. And I'll let Dr. Sharma speak to that because it's an MD question.
Thank you. So, yeah, this is a very exciting field.
Yeah.
We know when they're young, like before they pay taxes, their ability to regenerate and heal from injuries are incredible. How do we maintain that ability to regenerate long into our life, later decades? Sometimes we need exogenous, substances with exosomes, stem cells, the growth factors, peptides, hormones. All of that's important. We want to optimize the environment as well because we have to be in an environment that's going to accept the factors that we're introducing into it. Our body has the ability to regenerate, which kids show us all the time. But then those signals are suppressed. What is suppressing those signals? There's been some studies I encountered recently. They did a mouse model on knees. They accelerated the aging of a knee, and they suppressed a certain inflammatory marker in the knee, and they saw the age of the mice, relative age. The mice don't live that long, but they say you took a 60-year-old mice knee and it regenerated into a 20-year-old mouse knee just by suppressing the inflammatory mediator. So it was able to allow itself to regenerate. So if we're going to be introducing stem cells, PRP, exosomes, then do we need to also address the environment, make sure it's going to be accepted? Because right now it's expensive. We all, not getting into regulation because it's not readily available everywhere. So, and then what we're learning more and more is do we need to target it? Does it need to go directly to a specific site to generate the effect? Can we go to a central location, have a global effect? Some of the work with Sheldon Jordan, he's doing some exosomes that is ultrasound-driven into the hippocampus and is reversing our central aging clock that is telling ourselves, telling your 80-year-old body to say, hey, no, act like you're 20, and stop aging. And allowing your body to have a less inflamed state, have a more robust immune system, and robust, just healing capacity. I'm very excited where this field is going, where we can advance is really making it more accessible, and then also figuring out how to titrate the dosing and the treatment and finding out who's the appropriate candidate, who's an inappropriate candidate, what are the risks and benefits, and so we can advise more intelligibly on this, so we don't waste people's money and then give them potential health risk while trying to prevent a future disease.
You can keep talking if you want.
Is that something you offer at your practice?
Presently, no. But this is, I work with other people in the community who do offer this therapy, and so yeah, I do help to connect people.
Awesome. Anyone else have any questions or anything? No? Anyone want to look at their nervous system? I could scan it. And we could talk about optimizing it. It's, it's incredible, and this stuff works. Everything we do, your body will love you back when you love your cells. With the food, the thoughts, the life, the people you have around you, it's going to love you back. So, yeah, thank you everyone so much. Thank you to all the vendors that came out. You guys are all so amazing. It's what makes this town so great. And we're excited to keep thriving with you all. Does anyone have any other questions? I don't want to leave anyone out. No?
Does anyone have an excuse not to come to RadFest?
Yes, okay, yes. Yes. Are we all going to be there? We're all going to be hanging out again at RadFest. That's what we want to know. All right.
Yeah, thank you for saying that, because you're going to feel the energy we feel here. That's so great. We're going to multiply that together at RadFest. That's the great thing. We've met each other. We haven't had, dinner or lunch together, but we've made a connection here together. It's really beautiful. So thank you for that.